housekeeping. So we'll begin the webinar here just shortly, but we'll give it another minute for folks to join. But I do want to kind of do some housekeeping things. The mics are going to be muted for this webinar, so there's no mic functionality. If you do have questions, there's a function inside of the Zoom window to actually enter that question, and then we can look at that and address that at the end. There will be time for questions and answers at the end. We're planning for at least 15 minutes to kind of answer your questions. We will be recording this webinar here shortly. This webinar is part of the National Consortium of Telehealth Resource Centers webinar series. So we really appreciate the consortium for kind of arranging this for us and allowing us to bring this topic. And if we want to go ahead and start the recording, I'll go ahead and do some introductions. Thank you for coming to this webinar on cybersecurity and telehealth. It's an overview of kind of some cybersecurity topics. My name is Jordan Berg. I'm the Telehealth Technology Assessment Specialist with the National Telehealth Technology Assessment Center, or TTAC. And we're really pleased and kind of thrilled to have Julie Chua here with us today. She's the Risk Management Branch Chief for HHS Office of Information Security. Julie is an expert in cybersecurity and is going to be really kind of the key go-to person for some of your questions at the end. So like I said, I'm part of the National Telehealth Technology Assessment Center. TTAC is a federally funded telehealth resource center. We are funded through the Office of Advancement of Telemedicine. TTAC is a resource for the 12 regional telehealth resource centers and the one other national resource center. So we're the telehealth resource center that's focused on technology. There's a resource center out of California that's focused on policy. There are 3 members of the TTAC staff, and between us we have 50 years of telehealth experience. Here is a map of the telehealth resource centers. Most of us are pretty familiar with kind of who the telehealth resource centers kind of are in relation to this map. If you do not know who your telehealth resource center is, I would really encourage you to visit the National Consortium Telehealth Resource Center page and look up who your telehealth resource center is. They're great and free resources for people wanting to learn more about telemedicine. And at this point, I'd like to turn it over to Julie to kind of introduce herself and kind of what her organization is and what they do.
Great, thank you, Jordan. And I wanted to say thank you again for allowing us, the 405D team, to come here and address this forum. We are very appreciative and we value being able to engage with the telehealth and telemedicine community because we do know that there are some rising cybersecurity risks and impacts to this stakeholder group, and we are trying our best to provide any resource, assistance, and help that you are in need of. So if I were to say in a nutshell what the 405D initiative is, it is a group of government and industry experts who came together in about an 18-month period and agreed on the 5 current most prevalent threats in the healthcare industry, and they provided 10 cybersecurity practices that could help mitigate those threats. Another thing that they did a good job with is making sure that the publication that was released in December was tailored to a wide variety of stakeholder groups, as well as it is also tailored to be addressing a small organization and a medium and a large organization. So this slide actually gives you an idea of the path we took. And as I mentioned in our in my elevator speech, if you can think of it that way, this is a public-private partnership The driver behind this is an actual mandate from Congress, and it is called the Cybersecurity Act of 2015, and there is a Section 405D in there. Another thing that is very important to know about this work is it is ongoing, and we are welcoming new members to the task group from a lot of different perspectives. And I do think that the telehealth, telemedicine community has a lot to offer in terms of the work that we do. And if you have been able to read the document, which is called Health Industry Cybersecurity Practices, Managing Threats and Protecting Patients, so HICP for short, you will realize that we designed it to be accessible to a non-information security, non-cybersecurity expert. So we made sure that a physician, for example, or your clinician are able to understand what we mean by cybersecurity and why everyone needs to at least understand it from their point of view. Another thing that I wanted to emphasize is we did some national pre-testing on this document because we, specifically at HHS, we did not want this to be so complicated that no one would be able to pick it up again and read it and relate to their constituents what this actually means for them in their role. So I think, Jordan, you were going to go through the actual content of the document later on, but I'd like to leave with this as a small call to action to the group who is listening. If you are in any way interested, we welcome new members to the task group. This is a chance to weigh in and have your voices heard and make sure that the telehealth and telemedicine considerations are actually captured in the next iterations of the document.
That's great. Thank you, Julie. Okay, so what we're going to do for you today is we're going to provide a cybersecurity overview. And I like to come up with some alternate titles for things. So the other name for this is, damn it, Jim, I'm a doctor, not an information security systems officer. If you are a doctor, thank you for joining us today. If you're not a doctor, you can feel free to kind of substitute your job title there as appropriate. And if you are an information security systems officer, I really appreciate you showing up today, and thank you for being a part of this. This may be a little bit too high level for what you might be interested in, but what we're trying to do is really provide a very high level overview of kind of some core concepts around cybersecurity. The scope and impact of cybersecurity as it applies to healthcare and telemedicine is way too broad for us to address in a single webinar. But what we want to do is we want to kind of lay out some framework. Our goal today is not to really make experts, but we want to help make learners. And that means giving you some definitions, talking about why cybersecurity is important. And really, the main thing that we're trying to do today is plug you into some tools and resources like the HICP report and like the National Institute of Standards and Technology framework, so that you can begin to dive into cybersecurity, how it pertains to your telemedicine, telehealth program, and really begin to understand and be able to explain to your stakeholders why telemedicine matters. We also want to address a few telemedicine specific concerns around cybersecurity, and then leave you with just a couple big cybersecurity ideas that you can take home. So to start with the definition, what is cybersecurity? So according to the National Institute of Standards and Technology Cybersecurity Framework, the cybersecurity is the process of protecting information by preventing, detecting, and responding to attacks. And I think a couple things are kind of highlighted there. It really is a process, and it's really about understanding. It's an understanding that this is about risk management. and understanding the risks that any organization runs. If we're going to deliver healthcare, if we're going to deliver healthcare to patients where they are, we can't avoid cybersecurity risks. Cybersecurity risks are the cost of doing business. But what we need to do is we need to understand what risks are involved in the businesses that we do, what steps we can take to kind of mitigate or eliminate some of those risks, create a plan to address those risks that we've identified, and realize the continuous and changing nature of the cybersecurity landscape, and realize that, you know, we can make a great plan, but our plan has to change with the threats and challenges that are kind of coming up. And that's kind of why I like this little image of our cybersecurity castle made of sand protecting our information. The environment's going to change around the protections that we put up, and we need to be able to kind of constantly rebuild our cybersecurity defenses. And we'll talk about this a little later, but this is not kind of a static or binary process that we need to do. We need to make sure that we're constantly becoming more and more aware of some of the cybersecurity risks that we have to run as organizations, and then kind of how to mitigate those. We need to talk a little bit about why this matters, and this is probably the scariest content we have here. So just be aware. In 2016, the annual cost for healthcare breaches in the United States was $6.2 billion. And that was a report from the Ponemon Institute. In that same report, it indicated that 90% of hospitals had reported a breach within the last 2 years. Now, there are a lot of costs associated with these breaches. We have them kind of listed here, but the primary cost is lost business due to lack of trust from consumers. Small and medium-sized businesses are the most likely to be attacked because they don't have the resources to kind of combat a large cybersecurity attack, or they have fewer resources to combat large cybersecurity attack. And the cost for a healthcare breach per industry is almost twice any other industry in the financial, technology, education. Healthcare costs per breach record was about $400 compared to about $200 for some of the others. And in addition to the financial costs, the other costs we need to consider are costs in terms of access and patient quality of care. If our data is encrypted and we can't get access to it, or if our medical devices have been shut down due to a cybersecurity attack, we're not able to provide those resources. We're not able to have the best information in order to take care of our patients. There are accounts of hospitals having to turn away patients due to loss of critical systems. Other systems have had to pay large ransoms in order to get medical records back. And some systems have actually had to kind of close their doors because they couldn't recover from cybersecurity attacks. So we want to lay out some of the tools and resources that are available for people wanting to learn more about cybersecurity. The first tool we're going to talk about is the NIST Framework. This is the National Institute for Standards and Technology. This is kind of a core concept document for cybersecurity. It has been around for about 5 years. It's a living document. It's constantly being updated with new guidelines and best practices and standards. And what it really does is it helps us to have conversations and to organize how we approach cybersecurity. So with using this framework, we're able to really describe what our current cybersecurity situation is, what we want it to be. It helps us to identify and prioritize goals and things that we want to improve, and really kind of measure our progress along those goals. And probably one of the biggest things that it does, and this is going to become a recurring theme as we talk about some of these things, is it really helps us to communicate, both internally within our organizations and externally with other organizations that work in similar kind of fields, with vendors, with all of our partners. It really helps us to kind of create some standard language that we can use to communicate people about what cybersecurity risks we're willing to take, how we want to mitigate some of those risks, and how we're going to proceed in the current cybersecurity environment. So the framework consists of 5 different functions listed here. And they start with identify, protect, detect, respond, and recover. And we're going to go over these a little bit at kind of a high level, just so that you can see. I like to think of this as kind of almost like a bookcase where we can kind of organize our cybersecurity thoughts and our cybersecurity processes so that we can pull those resources down and we can have that information kind of collated in a way that makes it really actionable and usable. So for each of these categories, or for each of these functions, there's going to be several categories that are going to apply. And we can kind of see it here as we look at the identify function. We can see different categories of things that we can do of processes and procedures. So for example, asset management, business management. And then within each of those categories, there's subcategories that talk about very specific technical things that can be done for cybersecurity, and then there's a list of resources and references and standards that apply to each of those. So it's kind of a nesting table. And so if you want to get a high-level overview, you can kind of go in through that NIST framework and look at those kind of high-level, top-level contents to kind of get yourself familiarized. And then the deeper that you go into the document, the more technical and the more actionable materials you're actually going to be able to get to apply to your program. So when we're talking about the identify function, what we're really talking about is having a concept and understanding that business that you're in, the risks that you run within that business, the controls that you want to have in place to maintain or eliminate some of that risk level, and how this really works within the larger plan for your business. So identify is really looking at what you do, why you do it, and figuring out what cybersecurity, what you need to do within the cybersecurity space. When we think about the next function, protect, what we're really thinking about is all of the basically cybersecurity hygiene things that we need to do kind of on a continuous and reoccurring basis to make sure that we are protecting our assets. This is really the day-to-day work of cybersecurity. And there's, you'll notice, and again, it's another reoccurring theme, communication and training are really key recurring elements to any successful cybersecurity program. So the work of the protection function is really ensuring that people know what they need to do and how to do it, that they are who they say they are, that your data is secure when it's in motion or at rest, and that you have the technologies you need to secure your data. The detect function is really about how do you know if a breach has occurred and where risks for breaches are. So it's how do you monitor all of your organization or system to determine where you're vulnerable to breaches and then to know when a breach has actually occurred. The respond function is focused around what you do when you detect a breach. Having a plan for cybersecurity it isn't really all that helpful if you're not able to really execute that plan. And the respond is really focused on the plan that we created in the identify phase. We want to make sure that we're able to implement that plan successfully and rapidly and to really limit the amount of damage that's being done to our systems. And finally, the recover is really the efforts that we take to get back to normal business. And you'll notice here that a lot of this is about figuring out what happened, why it happened, what we can do to keep this from happening again, and how to communicate that information out, and really to respond to the attack and kind of what has happened. The last element here is the communications element, and that's really an important one. Again, we want to kind of push on this a little hard. Communications is really kind of how we build a cybersecurity herd immunity. So just like we do with vaccinations, the more people that are vaccinated, the more resistance we have as a community against disease. And the same thing happens with information. The more that we communicate with vendors, the more that we communicate with other health organizations, the more that we communicate with government entities that are looking into cybersecurity, the better information will be available to end users and to organizations, and the stronger our collective cybersecurity will be. So we'll have a link to where you can find the NIST framework and kind of how to access that information. But again, this is a very high-level overview of that and how it can be useful. We should point out that the NIST framework is it's not a healthcare organization-focused tool. It's a generalized organization tool, but it can be used. The concepts and are very applicable to healthcare as well as a variety of other industries. As we move into the HICP report or the HICP report, this is more targeted towards healthcare. Julie did a good job of kind of introducing kind of some of the core concepts of the Managing Threats and Protecting Patients report. It's focused on the 5 current threats that were identified in the report and 10 practices that can be done to eliminate or mitigate some of those threats. There are 2 technical volumes that are provided with the report. The first one is really focused on small healthcare organizations, and the second one is focused on medium and large healthcare organizations. And we're going to go ahead and break down some of the elements that we find in the report and talk about kind of how they can apply. And this report, if you are aware that you need to know more about cybersecurity, but you're not kind of sure where to start, and you're wanting kind of a plain text approach to getting up to speed as quickly as possible, this really should be required reading. It's not a very long report. The technical volumes are a little bit longer and they go into a lot more depth, but the actual report itself is a fairly quick read. Does a great job of breaking down what those threats are, what the practices are, and kind of how to implement them. It gives a lot of real life examples of what these threats might look like and kind of how to respond to them. It talks about different vulnerabilities that exist and then what practices will help to mitigate some of those vulnerabilities. In reading about cybersecurity, this is probably the most plain text, easy, kind of approachable document that I've had the opportunity to interact with. And really, it should be kind of required reading for pretty much any person in an organization, because one of the other points that we really want to hit a little bit later here is who's responsible for cybersecurity. It's not an IT function and it's not an administrative function. It really is a function that has to apply at every single level of a healthcare organization or of a telemedicine program. So if you have a variety of people working in your telemedicine program, maybe this should be required reading as part of your onboarding and training for folks that are becoming part of your telemedicine program. The 5 core threats that are identified in this report are email phishing attacks, ransomware attacks, the loss or theft of equipment or data, attacks by insiders, either accidentally or intentionally, and attacks against connected medical devices that may affect patient safety. We're going to go into each of these. What we've done for each of these threats is we've actually pulled out large materials from the HICP report and kind of presented them here almost in the same format that you see them in the report. The layout in the report is really good for looking at the vulnerabilities that are listed and then kind of really breaking down the steps that you can take to mitigate them. So the report is designed that you can actually go to the pages for these threats, pull them out, and actually have them as handy reference tools. So each threat is kind of a front-back sheet that you can hand to somebody and have a really helpful guide for them to look at some of the vulnerabilities that they may have in their own kind of work habits, and then some of the things that they can do to mitigate those. The 10 practices that are also identified in the report are listed here. Excuse me. We're not going to go in depth into each of these, but we are going to see kind of how they're applied as we look at each of the threats. You'll find some of these are kind of people-centric. They're evolve around training and making sure that the controls are there to kind of manage the personnel. A lot of these are kind of procedure based, that making sure that you have the kind of the rules and controls and plans in place to manage your cybersecurity environment. And then some of these are technology based. Making sure that your systems and your hardware and software are up to date and ready to kind of face different kinds of attacks. So let's kind of dive into some of these threats. We'll talk about what these threats are, some of the vulnerabilities that can make you susceptible to these threats, and then some of the practices you need to consider that might help you avoid losing data. So the first threat is the email phishing attack. And in reality, this is a gateway attack for a lot of the different, the other threats that we're going to see in this presentation. Email phishing is really someone pretending to be someone they're not through email to get you to give them data or credentials. These attacks will come into your inbox. A lot of times they'll look like other emails, other normal emails that you might see. They'll have links in them generally. Sometimes they're a picture, sometimes they're a link. They, a lot of times they're phrased in a way that's very urgent, like, hey, you need to respond to this right now. You know, if we don't get this, then, you know, this or that bad thing will happen. And when you click on the link, it takes you to somewhere that they use to harvest your credentials, either by entering them into a form that looks like something that you've seen before, or you know, through another method. Some of the vulnerabilities that cause people to be susceptible to these phishing attacks are really kind of a lack of an awareness about phishing, what it looks like, and kind of how to spot a phishing email. Lack of kind of resources for managing emails as they come in, for cataloging and kind of flagging suspicious emails. There's a lot more software resources that are coming out onto the market for actually scanning and saying, hey, this looks like a phishing attack. And then lack of really tools for checking that the email address and the domain that's coming from are actually legit and are not being spoofed or kind of fake. Some of the things that you need to consider when you're looking at phishing attacks, or you're trying to be aware of phishing attacks, is if you're getting emails from folks outside of your organization, emails that request information that you don't normally give, emails that really are pressuring you into providing information in a very urgent manner. And again, especially if you're not familiar with who they're coming from, yeah, being able to kind of spot these, it's you know, I live in Alaska, and one of the things that we have is, you know, being bear aware, you know, knowing when you're in bear country, knowing when you know, you might be susceptible to attack. We need to learn how to be phishing aware, knowing that, you know, when you look at an email, kind of what are the telltale signs? Are there spelling errors? Is the address similar to one that you would expect to get an email from, but slightly different? Be very aware of email attachments. And one of the things that we'll start to see more and more, and maybe some of us are seeing it in our emails already, is that when emails come in from an external source, they're tagged with the word external, or some other indicator to indicate that they're coming from outside of our organizations. So this, if you see that tag on your email, that just kind of should heighten your awareness a little bit to really look at the contents of that email a little bit more closely. And then one of the other things that you can do is to hover over links, actually, that before you click on them, to make sure that the text for the link actually matches up with the address that link is trying to send you to. After a successful phishing attack, the organization can be opened up to ransomware attacks. That's typically the pattern that we see. Ransomware is software that's installed into your network that really, what it does is it goes into your data and it encrypts it, and it provides that key only to the hacker, and then you actually have to pay them to recover that information, or you can lose that data. Some of the things that make you vulnerable to a ransomware attack is lack of system backups. Again, that phishing is the kind of the gateway that a lot of ransomware attackers use to get into the system. If you're not patching the different softwares that you use, having tools to really detect, and then making sure that the backups that you do have really work, so that you can actually recover your data and get back to operations. The practices to consider, and we'll notice this again and again as we kind of go through the other 3 remaining threats, is there's a lot of things that are very similar. And as you kind of address one threat, you can actually address multiple ones. The practices are a lot of them are the same, but you know, making sure that our software is up to date, making sure that we're using strong usernames and passwords, making sure that only people that really need to access the data are able to access the data, limiting the number of people that can access your network from outside, and then really making sure that we're sharing information, so that if you experience a ransomware attack, or you experience really any kind of cybersecurity attack, that you're sharing that with the cybersecurity community, so again, that we can increase that cybersecurity herd immunity against these sorts of attacks. Another key threat that was identified was the loss or theft of equipment or data. Equipment gets lost all the time in healthcare and medical centers. The loss isn't in the cost of the equipment itself. The loss is in the loss of the data, and the vulnerabilities that we're really introducing to our system. Some of the vulnerabilities are if you do not have good asset and inventory control, so you can track which devices are out there, who has them, and which ones might have protected health information on them. Lack of encryption, so that if you do have devices that are out there, that those are encrypted and the information on them can't be easily accessed. The next two here, or sorry, the next one here, the lack of physical security practices and safeguards. As I was reading through the HICP report, one of the things that kind of stood out to me that I didn't realize is that a more likely avenue of attack for loss or theft of equipment is in the office environment, and not necessarily out of the trunk of a car, or when a person is traveling. Equipment and devices are more likely to go missing from an office than they are from a device that's outside of the organization. So having some simple physical security practices, like making sure certain areas in your organization are locked, or securing devices to workstations and things like that to make sure that they don't walk off, is really, really important. Another thing to look at that I think is kind of key, particularly for telemedicine, and we'll talk about this a little bit later, but is that lack of end service process for devices. One of the challenges that we see a lot in telemedicine is devices reach that end of life cycle, as they're no longer really used. A lot of times they'll just get either discarded, or they'll get given or sold, and there's not a good process for cleaning all of that PHI off those devices to make sure that they're not creating vulnerabilities for you or exposing PHI. Some of the practices are to maintain a complete, accurate inventory of the different devices and memory or thumb drives, things like that that are out there, making sure that devices that do have PHI are encrypted, so that if they do leave your organization, that the data can't be accessed. Again, making good backups of the data that you do have, so that if you do lose a device, that you're not without that data, that you can actually continue to provide care. And really having good processes around what to do with data as it's end of life and it needs to be refurbished or resold. And then one of the key ones here that I want to really point out is encouraging employees and making it easy for employees to really report when devices are lost or when they may have been stolen. If if it's difficult or if it's problematic for employees to report when these things happen, they won't report it. And if you don't have a good understanding of what devices you have, these devices may be gone for long periods of time before it really is brought to attention. So making that process for really reporting those things simple, straightforward, and kind of a comfortable experience for your employees to really report that information to you is vital and key. The next threat we want to look at is insider, either accidental or intentional data loss. Any organizations that has employees or contractors or other people that have access to an organization's network and resources really have to consider the threat of accidental or intentional data loss. What makes us vulnerable is if we have files that get sent, and everyone has accidentally sent an email to the incorrect person at some point, but if we're emailing files with patient PHI or other methods or other data that we're sending to people and we're sending them accidentally to the wrong place. Not having tools to really monitor and track what PHI is being accessed from our different systems. And then really lack of training about the methods used, again, from phishing and other social engineering attacks to really get access to that data. So again, these practices are ones that we've really seen before, making sure that staff and users are really trained on the different procedures and controls that we have. Make sure that we're doing, we're really auditing who has access to the different levels of data within our organization, and creating tools in our systems to really know when we're losing data and if and kind of how to make sure that that data is secured when it's within our system. Another, we're going to talk about this again a little bit later, but for telemedicine systems, making sure that we're managing the users that actually use our different telemedicine applications. So if we have someone that's being onboarded or actually offboarded out of our healthcare, our telemedicine program, or making sure that they are actually removed, that their credentials and privileges are removed, so they no longer have access to that information from outside of our programs. And the last threat we're going to talk about today is attacks against connected medical devices that may affect patient safety. In the realm of telemedicine and telehealth, this is kind of a key one. There are more and more devices that have connectivity potential, whether that's an ability to access a Wi-Fi network or to actually physically connect to a network through Ethernet cables or a variety of other different methods. There are more and more of our healthcare devices, our medical devices, that are connected to our networks and then connected to the internet. So these are all kind of potential gateways into our PHI, and then the devices themselves can actually be vulnerable. And if those devices are attacked and we no longer have use of those devices, they can really impact patient care. The vulnerabilities that kind of can lead to an attack like this are devices that are not patched properly, so that the software that they are running is older, and it does not have all of the current security safeguards that to protect that device from an attack. Older equipment that is outdated and lacks kind of some basic security functionality. A lot of times these devices are not designed to be monitored by the other mechanisms that are kind of monitoring the entire organization. And then there's just a wide variety of different devices and different different systems out there that don't all work in the same way. So keeping track, and really a lot of this is about knowing what you have and keeping track of what those devices and systems are, so that you can actually properly monitor them. A lot of the practices, again, revolve around being aware of what devices you have, making sure that you're working with the vendor to make sure that you have the most up-to-date security patches and software patches for those devices. Having an inventory management system so that you can track which devices are vulnerable or have access to networks and the internet, whether that's through a MAC address or an IP address or other networking capabilities. And then really, I think the last one here is vital to telemedicine, is that as we go about the process of looking for devices and we're doing that device procurement phase of our telemedicine programs, we need to make sure that we have a stakeholder, an information security stakeholder at the table with us who can really help us provide that feedback as to what level of risk are we running by picking device A or device B. You know, more than just having an IT person in the room, having someone with actual information security expertise able to really look at a device and give us some feedback as to whether or not this is something that we want to look at. We're going to talk a little bit about some telemedicine specific concerns. We kind of highlighted these as we went through, but I do want to feel like they should be kind of reiterated again, just so that we kind of really emphasize this. Some of the things that we see in telemedicine programs is that user management access is really not maintained very well. Different users are brought in, they're added to the system. That information is really not managed at the IT level, it's managed at the programmatic level. And then as people leave, they still have access to the system. And a lot of the programs and applications that get used and devices that get used, you can access those through the internet, through the web. So you can go to a website, log into a portal, and have access to that data. So telemedicine programs really need to be aware of which users are in their systems and whether or not those users should have that access, and then removing that access when that person either leaves the organization or leaves the department, so we're not exposing that information. Cybersecurity really needs to be a vital part of vendor selection. So as you are looking for either a telemedicine platform, a telemedicine device, you need to be asking those vendors some of those key cybersecurity questions. What information do you collect? Where, if you're in a cloud, I'd like to see your audit reports for your cybersecurity audit reports. Really kind of make those queries part of that selection process. Asset management. We have a lot of telemedicine devices that are out there. Sometimes they're sitting in drawers, sometimes they're out with patients, sometimes they're in a clinic. Knowing what those devices are, where those devices are, and kind of what information we can expect to find on those devices is really an important thing that doesn't get done probably to the level it should be done. And then we're seeing more and more telemedicine devices that can independently connect either to the internet or to a Wi-Fi network or to a hard connect to a local network. Realize that each of these devices we bring into our organization, we're potentially bringing another point of access, and making sure that that both we know, our IT department knows, our cybersecurity officers know what devices we're bringing into the organization and kind of how they're connected, so that we're not either losing those devices to an attack or exposing our data to risk. And then device management and kind of around mobile devices. A lot of telemedicine is designed to be used with mobile platforms, and how are we making sure that those mobile platforms are secure, that the data that's on there is the data that should be on there, that we're not storing a bunch of patient information in the camera roll, that the devices are able to be locked and encrypted, and kind of secured when they're not in use. Those are kind of some of the telemedicine specific concerns that I thought we should bring up. I'm going to turn it over to Julie to talk about kind of some big ideas in cybersecurity, and kind of some big thoughts to kind of sign us off here.
Great, thanks, Jordan. And I am mindful of time, so I want to just leave some big food for thought So the first one, cybersecurity is not a passive or binary state. What that means is it is about risk management. And Jordan did a great job with emphasizing that throughout all the components of the resources that we are presenting to you today. And really that the key thing is we will always have risk. So it is better to share that information with everyone in your organization and whoever it is that needs to address and manage that risk and work together to do so. And that connects with the cybersecurity is not an IT issue. That is something that from an HHS perspective, we are really emphasizing on. It's a key theme that we are sharing with our stakeholders, because we need to make sure that every single person in an organization knows what their impact is and what their role is in terms of making sure they are either aware of cybersecurity or they know what they can do on their own. It's as simple as being aware of what a phishing email looks like Jordan mentioned. And it's as simple as knowing who to call if you think you are being phished or if you think that there is a suspicious link. A lot of those things are very intuitive for a cyber professional, but we are acknowledging that it's not intuitive to a clinician or a nurse, and a link may just be a link and it looks okay to them. So being hyper aware is what I've been saying these days is not a bad thing, because attackers are very, very resourceful and very deceptive. So we need to be vigilant about that. And last but not least, of course, it is a vital part of providing healthcare. So for HHS, it is fundamentally about patient safety and uninterrupted care delivery. And I think the media does a good job with letting us know how that affects how we care for our patients, how a cyber attack does divert care, prevents us from seeing our patients, delays treatment. And these are things that are not to be ignored. And I think if we are all thinking of this as a team sport, then we are all the better to tackle this together. And I think, Jordan, that kind of gives us a good segue to maybe questions that the group has.
Yeah, so we also included some resources here. We reference these two documents pretty heavily, so we want to make sure that you have access to get to both the NIST Cybersecurity Framework and then the HICP report. Again, these are great resources, kind of required reading for learning about cybersecurity, so make sure that you kind of go to those sources and learn as much as you can. And then, yeah, let's move on to some Q&A. We do, again, in the Zoom platform, there's a Q&A a button there. You can actually type in a question. So we're going to let Julie answer as many of these questions as we can, kind of in the time that we have. So please go ahead and submit those there. We did have one question that came in, Julie. What about patient portals? So either like, and I'm elaborating here, so like in the EHR or through different telemedicine platforms, are patient portals a source of security concern?
Absolutely. And I would say if you have an EHR vendor and you do have a patient portal embedded in the EHR vendor's solution, then you should be covered in terms of the security measures that they put forth. So the follow-on to that is, as a client or a customer, we all need to make sure we know what our vendors are doing in terms of their security requirements and if they meet our risk appetite or risk tolerance. So that is a long answer to yes. There are a lot of attack vectors in a clinic environment, and patient portals are definitely one of them. You can have credential mining from that, shoulder surfing if you get into a little bit more non-cyber, but it's still a social engineering, if you've heard of that before, and that sort of thing. So good question.
Julie, can you talk a little bit about social engineering and kind of what that is and how that pertains to cybersecurity?
So phishing is a good example of a social engineering where you don't have physical contact with the attacker. So they're deceiving you to give them information. And they're posing as your HR person or the store that you always interact with, and they're telling you you have a prize that they're wanting to give you. The old school social engineering is, for example, me coming into Jordan's office and saying, hey, Jordan, I need this information and I actually need your password to get into that so that our boss can make some decision. That's social engineering. You're tricking someone to give information about you or information to access your account or a work account that they shouldn't have access to. Trying to simplify. I hope that helps.
That's great. So we got a question about whether or not the email and resources will be available with recording. I will send out a PDF version of this presentation, and I believe we can absolutely have that up on the website with the recording, so you guys have access to that. Julie, was there any, as you were kind of assembling the HICP report, was there anything that kind of had surprised you or that you found that you hadn't expected as either like an attack vector or that people were kind of raising that you, as an IT specialist, that you weren't really aware of in terms of healthcare?
I would say no. The task group members, they were pretty keen on how they wanted to scope this document so that it is something that can be picked up by pretty much anyone in an organization, no matter what role. So there were a few surprises when we were talking to actual physicians and clinics in rural areas, trying to get an idea of their awareness of cybersecurity and what they would do about it. So intuitively, you would think they know about cybersecurity, so yes, they are going to make it a priority and do something about that. It was actually the opposite, where they knew about the impacts of of a cyber attack to them, but they think that one, they're not going to be attacked or breached because they're so small, or two, they've kind of raised their hands and said, I don't have the resources, I will be attacked anyway, so I'm not going to do anything about that. To me, those were eye-openers. If I hadn't seen that in a movie, I probably would have said that's not something our stakeholders would think and feel, but those were things that we heard. So we were trying to address those, make sure it is clearer that there are certain cybersecurity measures you can take without too much of a cost, and acknowledging that there are certain things when it comes to actual technologies, though, that of course need some resources. So I thought I'd share that anecdote to the group. So, and to kind of follow up on that, so a lot of our audience tends to be kind of smaller organizations or rural organizations. If you could kind of share kind of some key small or rural cybersecurity practices that you think would really kind of like most bang for the buck, things that people could do to be more aware and protected. What would you recommend? Sure, that is a tough question because as you know, with risk management, it has to really tie in with what your threats are or what you think your threats are. So that to me is key. Knowing that I am susceptible to email phishing because I deal with emails every day. And if I think that is something I need to hone in on, then I would look at that first threat and the practices there. It's tough to pinpoint, and that's another thing, Jordan, why the task group also was very careful about prioritizing or saying do this first, because it really needs to be what is relevant to my organization. So a more concrete answer then is, as you pointed out, the threat pages are meant to be pull-outs. And if anything else, what we've heard from physicians that we talked to who read the document already, they found the quick tips in there very helpful, because it states what to ask, who to ask, and what to look for. And it gives you like very simple bullets and when to ask. So if let's say a one-person practice and there's only a practice manager and a physician, I would point them to those quick tips for all the 5 threats.
Yeah, and again, we talked about this a little bit, but you know, that report really is, you don't have to be you don't have to even be really computer savvy in order to get something out of that report. And I really do want to emphasize that you know, if it's probably something that you could even really share with you know, a parent or, you know, someone like that, just to kind of get them up to speed and kind of know, because, you know, these are specific to healthcare, but, you know, they're actually specific to all of us. You know, even in our, and I think that's another thing that you kind of should emphasize, is that it's not just what we do at work. You know, because of our kind of connected data lives, even things that we do at home, or you know, our relatives do at home, you know, we're all interconnected. We all have kind of all these hooks into us from all these different platforms. You know, so being just cyber aware in general in every element of our lives, and kind of just knowing enough to you know, to be aware is really important.
Yep, agreed.
So we have a question. So what would you do in the case of patient portals? Are there certain things you can tell patients to do, or is it based on the different EHR vendors?
Both. And it all goes back to that key message of it's everyone's responsibility. So for patients, they need to make sure that they are securing their logins and passwords, and only sharing it with those they want access to their accounts with. From the EHR vendor perspective, as the client, we need to really make sure, if the EHR vendor says, yes, we are encrypting, and that is actually a requirement, then they should be able to show you that they are encrypting. It's trust but validates, as a great person once said. And I know that that is a challenge in terms of, you know, third-party vendors and your EHR vendors, but that's one way to hold them accountable, is they know what you are looking for. And that knowledge is key, plus making sure that your contracts are laying that out also.
Yeah, and one of the things that as we've kind of worked with people, is there's a lot of kind of boilerplate contracts that are out there that people sign for, you know, as you know, covered entities and things like that. Really getting your legal team to really look at that, and really creating your own contracts that really emphasize the cybersecurity elements that you really want to emphasize with a vendor is hugely important. You know, just don't necessarily take their boilerplate and say that that's going to be good enough for you. They may not be emphasizing the risks and threats that you really think are kind of key, and understanding that and knowing that from a feature point of view, but also from a contractual point of view.
And if I may add, so the technical volume 1, it does touch on a lot of, what should you be asking or be aware your vendors should be doing. So, and that's the volume for small organizations, because the task group did not want to assume or did not want to make it that the small organizations should be doing these, because they know that most of these are outsourced.
Okay, well, some good questions that have come in, some good discussion. If there aren't any other questions popping in here in the next few seconds, I think we'll go ahead and close the session a few minutes early. We really appreciate everyone attending. I've had a couple of requests. We will go ahead and find a way to make the presentation available to folks. I think that's kind of standard for these NCTRC webinars, but we'll make sure there's a PDF version out there so that you can actually get access to the links and kind of have this as a resource for you. The kind of to leave us off, having conversations like this, talking about cybersecurity in plain and simple terms, and making sure that stakeholders throughout our organization and patients too. I think that's one of the things, making sure that patients are aware of some of the risks that they kind of run with their data, and kind of how to mitigate some of those as well. These are really the kind of the key things that are going to make our world kind of a more cyber-friendly place, and more secure place. And they're going to help us make sure that we have the information that we need when we need it to give the best patient care, but make sure that that information doesn't get in the hands of people that really shouldn't have it. So I really appreciate you being a part of this conversation with us today. Thank you for having us, and I hope that this is helpful and instructive, and really a gateway for a lot more learning about cybersecurity for you and your organization. Thank you very much.